So many people don't realize, but the number one ingredient in the human body, 65% of your elemental composition is oxygen gas. And everybody has deficiencies. It doesn't matter who you are, elite athlete, all the way to the sickest person. And so we have all these different therapies that help to get oxygen to cells. And one of our favorites is hyperbaric oxygen therapy. So I'm going to have a podcast in a few minutes talking to you about this amazing therapy that we do. I hope you enjoy it. Stay tuned.
Hello, everybody. It's Cameron. Today I'm here with Dr. Chris Cormier. We're going to be continuing Oxygen Week by talking about hyperbaric therapy this week. So, Dr. Cormier, what is hyperbaric therapy and why is it so beneficial?
So, hyperbaric oxygen therapy is a therapy where you get placed into a chamber and the chamber starts to pressurize. It's very similar to like going down in altitude. So, basically, the further down in altitude you go, the more pressure there is. And so we're at 1 atmospheric pressure here while we're standing on planet Earth. But then when you go down, the more atmospheric pressures you get. So in this particular chamber, you're in a chamber under pressure and you're breathing 98% oxygen while you're in that particular chamber. So that pressure is pushing oxygen into all your nooks and crannies and all the different trillions of cells that you have.
So what happens when these oxygen molecules are pressurized?
They're forced to push in to all these little parts of your body that may have been low in oxygen before. And so you got to imagine, I always talk about nobody breathes enough and we don't know what we're breathing anymore. And go back to just oxygen, right? It's our number one ingredient. When you look at ingredients in the human body, the number one ingredient, 65% of your normal chemistry should be oxygen gas. Yes. And unfortunately, nobody breathes enough and we don't know what we're breathing anymore. So of course, people have areas, cell groups that are low in oxygen and they need to get oxygen. So when you're in a particular hyperbaric chamber, it's pressurizing and pushing oxygen into all those little nooks and crannies that have been low in oxygen.
So how does pressurized oxygen differ from just normal breathing?
Yeah, so breathing, certainly we recommend breath work and breathing exercises. That's fantastic. But that's great for just getting more oxygen in your system. But this particular therapy, because you're under pressure, it's literally pushing that oxygen into all those little areas that have been low in oxygen. So breathing certainly has that capacity as well. But this is a much higher level of pushing that oxygen into the parts that need it.
100%. How would these hyperbaric oxygen therapy, how would it be beneficial for cellular energy production?
So again, when it comes to oxygen, mitochondria, they're the powerhouse in your cells.
Yes.
They don't work without oxygen. So you have to get oxygen to them to fuel them so that they get your energy. And so cells it's the most important ingredient we have for that reason, because if you don't have any energy, you don't have anything.
Personally, and I'm sure for a lot of others, we've seen a lot of USC fighters and football players now using these hyperbarics. Why do you think that they're using them more?
Because they know it works.
Yeah.
They feel better. They know they recover quicker, and they feel like their body is self-healing at a higher level when they do more of these therapies. I'll use Joe Namath, for instance. He probably had more concussions, and I know he probably had a lot of drug use and stuff like that over the years, and he swears that this hyperbaric therapy, oxygen therapy, reversed all those effects that he had, from all those particular injuries. So many athletes out there know that this is great, and they know the benefits, and they feel the benefits, and they want to continue it.
Can this also, like the hyperbaric oxygen therapy, can it also influence brain function and clarity?
It's the only therapy that softens the blood-to-brain barrier and allows oxygen to get into the brain. So, so it's really just so advantageous to getting vital oxygen to all parts of the body, especially the brain.
You talked about the use of it for athletes and stuff like that. What about for patients that may be very, very ill? Would hyperbarics be something that they should use?
Again, I'm going to go back to science, right? The number one ingredient in the human body is oxygen gas. The presence of oxygen means the lack of disease.
Yes.
So basically, when it comes to anybody, whether you're an elite athlete wanting to feel better or you're somebody that's really, really sick, you need oxygen because it's our number one ingredient.
What are some limitations that people may have that limit them from using the hyperbaric oxygen therapy?
The primary limitations we see are when somebody has issue clearing their ears, where their ears are sensitive to pressure. So then it becomes harder for you to feel that change in pressure when you're going down. And it if let's say somebody has a sinus infection, that would be something else. The good news is a lot of the implants nowadays, like even pacemakers, they're actually rated on pressure. And because they know hyperbaric oxygen is such a good therapy, that they make these devices that they implant into people higher where they can sustain pressure. So there's not a whole lot of contraindications that we see because we're not in the ER and seeing people on a deathbed with a blood clot or those types of things. We see people like a pneumothorax would be an example where that would be a contraindication, but typically we won't see patients that way. We see them where they're just overall trying to feel better, get better, and have all these different conditions that they want to get. So the main complications that we see here would be just mostly clearing the ears.
So in your opinion, do you think that many people are just overlooking this basic driver of energy?
Yes. I have the hardest time convincing people that the number one ingredient is oxygen gas. But yet don't try to not breathe.
Good luck to you.
Yeah. It's not going to work out really well in your benefit. And you can totally see the science behind it, right?
Yes.
But unfortunately, like I said, nobody breathes enough. We don't know we're breathing anymore. And of course, people are low in oxygen. And just to even validate more, there's no scan right now that'll show you exactly all the parts of your body that are deficient in oxygen. And so hopefully in our lifetime, we have something that, I always say it into existence, that we'll have something that we invent. But for right now, we know everybody's deficient in it and everybody needs more.
100%. What do you think that people should start paying attention to today?
The basic ingredients in the human body.
Yeah.
Because if you go back to the basic stuff, for instance, if we just talk about big pharmaceutical companies, and I'm not going to talk all bad about them because there could be some good, but they want you, when you have any symptom at all, they want you to think it's a deficiency in a pill.
Yes.
But really, that's not where it starts. If you have any symptom at all, it's going to start with a deficiency in oxygen. It just is what it is because none of us are breathing enough. We don't know we're breathing anymore. And over time, cells get low and they get sick. And so if you just start with basic ingredients, like we talk about oxygen, water, light, all these different ingredients that people just overlook, you can make yourself so much better by getting basics back in.
Well, thank you very much, Dr. Cormier. That does conclude our talk for today.
Thank you so much. If this podcast spoke to you, or if you feel like you have family members or friends that have these types of conditions that could benefit from this particular technology, then all you need to do is become a bodychargers member or tell them about bodychargers. Remember, it's our community that I created to help people at home with the best technologies in the world to be able to help you to self-heal your body at home and maximize your self-healing. So go to bodychargers, become a member. That's the easiest way to get this done. And we look forward to serving you and your family. Also, if you want a higher level of care, we have the Nerve Health Institute you can always come to. That's our clinic where we have higher level services here to be able to help you. So I hope you enjoy, and we look forward to serving you and your family and look forward to our next podcast.